So this was quite an interesting question of somebody having mid-luteal spotting. Spots day 8, day 9, just a bit of spotting, normal progesterone levels, luteal phase 12 days. No signs of endometrial polyps, fibroids, or cervical erosion. The spotting stops pretty straight away and then follows with a period. Let's look at the research. Spotting before the onset of menstruation is very common, observed in about 40% of menstrual cycles in healthy premenopausal women. Most commonly, this spotting occurs within 5 days leading up to menstrual bleeding and is often continuous with the period. The luteal phase of 12 days is normal. Anything between 11 and 17 days seems to be within the normal range. Less than 10 days is considered to be luteal phase defect. If you look at the hormonal patterns, research shows that as long as the progesterone is normal, premenstrual spotting is not due to decrease or low progesterone levels. The main hormonal difference in spotting cycles is that there seems to be a lower rate of progesterone decline in late luteal phase rather than the absolute deficiency in progesterone. For the start of menstrual bleeding, the hormone levels are similar in those who spot and those who do not spot. This suggests that spotting may not be necessarily due to inadequate hormonal support or luteal phase defect, especially when mid-luteal phase is normal. Now, let's come back to diagnosing luteal phase defect. That's extremely challenging, and luteal phase is difficult to diagnose definitively. Neither a single progesterone nor an endometrial biopsy is reliable or a specific indicator. Luteal phase defect is usually considered only if the luteal phase is consistently short, less than 10 days, or mid-luteal progesterone less than 10 nanogram per ml. Thus, in this case, where there's a bit of spotting, I do not think there is any serious problem. And I think if you've been trying for more than 6 months, and if it is persisting, it's worth having a look. It's important to rule out cervical erosions, cervical polyps, uterine polyps, and fibroids in this case. Some women seem to be simply more prone to spotting due to these endometrial factors, not because of a hormonal or structural abnormality.